The following portion of Studio 512 is sponsored by Advanced Pain Care. Hey y'all, going through cancer, of course, can be really challenging, both emotionally and physically. Pain management specialist Dr. Marco Uribe is here to talk to us about how advanced pain care can address specific issues affecting cancer patients. And actually, Dr. Uribe, I'm going to ask you to get a little personal right off the top here. Talk to me about why you wanted to become a pain interventionist, especially when it comes to cancer care.
Yeah, this is really, something that really hits home for me. My younger sister, Marissa, we were growing up here in Austin. She was battled through cancer for most of her life. When I was in medical school, she got diagnosed with late-stage colon cancer and had a lot of pain. And just her battle through that introduced me to what pain can do for not only the patient, but for the patient's whole family and their relationships.
So let's talk about the common types of pain experienced by cancer patients and maybe how that differs from typical pain that somebody else might experience.
Yeah, it's definitely different than your typical pain patient. Cancer pain, is very multifaceted. You have neuropathic pain, which is pain from the nerves when sometimes the tumor is growing or sometimes the cancer is advancing and it's impacting nerves, sending sporadic signals that we can intervene with.
Let's talk about what the different treatment options are that are available for managing cancer pain.
Definitely, there's a lot of different options. With cancer pain, it's the whole patient, like we've talked about. Oftentimes one of the cornerstones of therapy is medications, but with cancer patients uniquely, they're oftentimes on a lot of medications that may be the cause of some of their pains.
Right.
So yes, we use medications to the best extent that we can, and that's what they're for patients that are going through this battle.
You guys have a host of ways to help people in all different types of pain.
Exactly, yeah. So using a whole team is very, very important. It's not just the body that's sick, it's the whole human being and, their experience with their relationships and their mood and their sleep. And so we use an interdisciplinary team approach at Advanced Pain Care with psychology. We communicate with the oncologist. We communicate with, the surgical oncologist.
Absolutely, getting better outcomes for patients who are in pain. Dr. Uribe, we really appreciate your time. Thank you.
Thank you for having me.
To learn more about what you could do if pain wasn't holding you back, talk to the doctors at Advanced Pain Care. Go to austinpaindoctor.com to get help managing your pain today. The preceding portion of Studio 512 was sponsored by Advanced Pain Care.